Any path to recovery and a stronger and safer future requires us to keep contained this highly infectious and deadly COVID virus. Containing the virus will require us to protect as many persons as possible with the best tool available to us. That tool is the vaccine, and with more than 4.72 billion doses already administered globally, leading to a significant decrease in hospitalizations and death from COVID-19, we know that it works. We have done almost everything within our power to get our people to come forward voluntarily to be vaccinated. Some have chosen not to do so, and they do have a right to make that choice. There comes a point in time when overwhelming scientific evidence and common sense have to prevail. Just because you have a right to choose does not mean that you do not have a responsibility in this fight. Every one of us who can be vaccinated has a moral responsibility and a duty to this country and its citizens and residents to do so, as by protecting ourselves, we provide protection for others, especially those who cannot protect themselves. Though battle-weary in this fight, we continue to educate and encourage the undecided and unvaccinated to come forward voluntarily so that we can get a high threshold of population immunity where we can safely and fully reopen our country and get the economy back on track. The situation update. We are still in the middle of a pandemic. Globally, there have been over 207 million confirmed cases with 4.36 million deaths. In the Caribbean region, we have had just over 1.38 million cases and 17,000 deaths. Here in the Federation, we had 708 cases to date with 590 recoveries and 115 active cases with 3 deaths. Currently, there are 6 hospitalized. We are in community spread like almost every other place on the face of the globe and continue to fight to keep it contained. We continue to report daily positive cases and are beginning to see the numbers climb again as complacency sets in. We had 13 new positive cases on Saturday, 24 on Monday, and now 27 today, after recording daily low single-digit positives and sometimes 0 since the lockdown. The majority of the recent cases were picked up through contact tracing from recent social gatherings and the early childhood school sector. This shows that every time our people let their guard down, the virus surges. The analysis of the data in the current wave from May 19th to August 3rd shows that of 558 positive cases during that period, 81.5% of the cases were in persons under the age of 50, with 23.8% in the 0 to 19 age range and 42.9% in the 20 to 39 age group. 248 cases, or 44.4%, were unvaccinated adults. 113, or 20.3%, were children who could not be vaccinated, and 101, or 18%, were persons who were partially vaccinated. Only 70, or 12.8%, were fully vaccinated. We see, therefore, unlike early in the pandemic, that we are having younger persons becoming infected, and the vast majority are not fully vaccinated. Also, our children who are dependent on us for protection are now being adversely affected. This situation can be arrested by more persons coming forward for the vaccine. If you are on the fence and hesitant about getting vaccinated, this should be the tipping point for you now. The vaccination program. The CDC director recently said that we now have a pandemic of the unvaccinated, referring to the rising cases in the USA among the unvaccinated. The virus is searching for the next person to infect, and more often than not, it will be the unvaccinated. We see that happening here, as more than 87.2% of our new infections were not fully vaccinated. We now have 72.9% of adults covered with one shot and 61.6% fully vaccinated, and this is highly commendable. Our high vaccination coverage is the envy of many countries. I was in a regional meeting with our Prime Minister last week where every leader was amazed at our high vaccination rate and wondered what was the secret to our successful vaccination program. My response to such questions is encapsulated in one word: confidence. Our people had confidence in the message that was being delivered through our education program about the vaccine and its safety and efficacy. Our people had confidence in the health services offering the vaccine, which is why they turned up in large numbers at our health centers throughout St. Kitts and Nevis to be vaccinated. Our people had confidence in the policymakers deciding on the rollout, starting with our Prime Minister Harris, the Minister of Health, the Chief Medical Officer, and the entire administrative staff of the Ministry of Health. We, however, cannot let complacency set in and must continue our drive to get everyone who should be vaccinated out to receive the vaccine. We must understand that we all have an individual and collective responsibility, one to protect ourselves as individuals and another to protect others from infection through our vaccination. The vast majority of the remaining 8,961 unvaccinated adults may not have a political agenda or may not be committed to an anti-scientific cause, as some may think. In my day-to-day one-on-one conversations with persons who are unvaccinated, I find the majority as simply undecided about their choice to take the injection, and many as simply being misled by misinformation. The good news is that once presented with the facts, they are changing their minds, which is why we continue to have a slow but steady increase in our vaccination numbers. Being unvaccinated is neither a race nor a gender that cannot be changed. This is not the time to divide ourselves into vaccinated and unvaccinated groups, or the virus will prey on our divisions. On May the 17th this year, we only had 11.4% of the adults fully vaccinated. In 3 months later, on August the 17th, we have 61.6% fully vaccinated. That is a 50% swing from unvaccinated to fully vaccinated in just 3 months. This is clear evidence that being unvaccinated is not a permanent and unchangeable status. We will continue to have open dialogue with the now 8,961 unvaccinated adults among us and continue to shrink this number as we bring them into the fold of protection through vaccination. I strongly encourage those in leadership positions who know better to assist in sending a clear message that the vaccines are safe and effective and use their platform to promote vaccination. The Delta variant. With the high transmissibility of the new Delta variant, there is an increased urgency to reach as many people as quickly as possible with the vaccine. The Delta variant is the most contagious variant we have seen so far. The World Health Organization has called it the fastest and the fittest of all variants. Without vaccination and a mask, an infected person with the original virus will infect 2.5 other persons. Under the same conditions, a person infected with the Delta variant will infect 9 other persons. Some data suggests that the Delta variant might cause more severe illness than previous strains in unvaccinated persons. I said a couple of weeks ago that it was only a matter of time before the Delta variant arrived at our shores. It was not a matter of if, but when it was going to arrive, and that we all needed to prepare for this eventuality. Samples were sent off to CAFA for genomic sequencing on July 28th. The results returned over the last 24 to 48 hours confirmed the presence of the Delta variant in one of the samples tested. This was an inbound passenger who was in quarantine and has since recovered. It is comforting to know that the Delta variant was found in someone who was in quarantine and has since recovered and was not found at large in the community. We will be sending off further samples for genomic sequencing. A number of our neighbors on this side of the globe already have the Delta variant, including Trinidad and Tobago, Grenada, Martinique and Guadeloupe, Barbados, Puerto Rico, Anguilla, Saba, the United States Virgin Islands, and St. Martin. We will not be spared, and we must be prepared for the eventuality. If too many people remain vulnerable and become infected with this variant, our healthcare system will become overwhelmed and more people will die. The unvaccinated among us are at greatest risk. Unfortunately, most of our children who cannot be vaccinated can be more impacted by the Delta variant than other variants or the original virus. Our elderly are also more likely to become symptomatic, be hospitalized, and die if infected with the Delta variant. This means that they are even more dependent now on us who can be vaccinated for protection. Yes, it is true that if you are vaccinated, you can still get infected by the Delta variant, but being vaccinated offers you significant protection against symptomatic disease, hospitalization, and death. The vaccine is our best defense against this highly contagious and deadly variant. The higher the proportion of the population fully vaccinated, the better our defense will be against the Delta variant. Our health system. Our health system remains robust, and we must continue to strengthen it, as its resilience is at the core of every decision we make as we move forward on a path to recovery and living with COVID-19. We recently said goodbye to the Cuban medical contingent that came in to assist in the fight against COVID-19, and I want to publicly thank them for their contribution. I want to remind you that the help came at a cost. The cost to the Federation for salaries, accommodation, and air travel was $4,224,583.03. Our able local staff will continue the fight we started from the first day the deadly virus hit our shores early last year. They recently benefited from 2 training courses organized by PAHO on Pfizer vaccines in preparation for the vaccine's arrival. We received a donation, as you heard, from the U.S. government of 11,700 doses of Pfizer vaccines last week and expect a further 23,400 doses. We now have 3 ultra-cold storage -20-degree refrigerators and 1 -80-degree refrigerator. This shows advanced planning and preparation for the arrival of the Pfizer vaccines that require ultra-cold storage devices. The vaccination team is continuing the training and preparation to begin the vaccine rollout of our teenagers sometime in September. We have managed a total of 103 patients at the COVID ward at the Joseph and France Hospital since the start of the pandemic, 34 last year and 69 this year. The vast majority were unvaccinated. We have had 3 deaths. There are currently 6 patients hospitalized. The average cost per day to treat a patient on the COVID ward is $5,522. We have a total of 35 ventilators on standby to manage persons with severe respiratory disease, but we can avoid having to put them into use by us protecting ourselves from severe disease by getting vaccinated. We recently received 20 oxygen concentrators as a gift from the Republic of China, Taiwan. These could supply supplemental oxygen generated at the bedside from room air for persons with mild to moderate respiratory disease from COVID. While we continue to spend large sums of money to equip the institution with the expertise, drugs, and equipment to fight COVID-19, we can lessen the burden on the healthcare system by simply getting the vaccine that is given free to all adults and soon to our 12 to 18-year-olds. Finally, the path to recovery. There are many complexities and challenges that this pandemic has presented, but over the last 18 months, we have safely navigated the course and are now on the path to recovery. The path to recovery and getting back to a stronger and safer future requires that citizens and residents now take personal responsibility to protect themselves by wearing a mask, hand sanitizing and social distancing, and for every adult who can be vaccinated to be vaccinated. We now have vaccines for the 12 to 18-year-olds, and I urge parents and guardians to bring these teenagers out to be vaccinated. Vaccinating quickly and thoroughly those who can be vaccinated to prevent the Delta variant and other variants from gaining a foothold in our communities is key to a stronger and safer future. If we have a significant proportion of the population protected through immunization, we can safely open the tourism industry, which is the backbone of our economy. We can safely bring every sector of society and our economy back to near normalcy if the majority of us are protected through vaccination and indirectly offer protection to those who cannot protect themselves. The vaccine is, however, not a bulletproof, and if we begin to interact like the pre-pandemic era, we will be back to square one. Non-pharmaceutical interventions will continue to play a crucial part in keeping the cases down. I urge everyone to get on board and help us to control the viral transmission as we embark on our path to recovery. I thank you.
Thank you so much, Dr. Wilkinson. We're now going to hear from the Permanent Secretary in the Ministry of Education,